about toxicity in general. Toxicities can block any of these pathways. So I can have a perfectly open pathway, meaning I have no genetic defects, but I have a toxicity and it blocks that pathway. This is one of the theories, actually, with why there's such a high incidence of autism in the United States versus other countries, that it's been researched that use the same vaccine schedule. Here was one of the conclusive differences. In the United States, doctors are taught that you should go home and give your child Tylenol so that they don't have any ill effects of the vaccine. Tylenol blocks the MTHFR pathway. So if I have a double allele defective MTHFR C677, I already have a 65% on average reduction of that function of that gene. And then you give Tylenol, that kid is toast. Other countries that don't have the same autism rate don't suggest Tylenol. So this is where I'm not, do vaccines cause autism? No, the toxicity causes autism. You have those defects and you have other compromised things, you're going to have you're going to have brain issues because of that. So if you have to choose a pain medication, and if you don't have that one ABP1 gene that detoxes NSAIDs, and that's clear, Tylenol is not your best choice, anyhow. Matter of fact, there's another friend of mine, Dr. Susie Cohen in California, who's a functional pharmacologist, who wrote a really nice book on the genes. Oh, she didn't write a book, but she wrote a book on the pharmacology and its function in the body and the ill effects of it. And she has a really nice chart system on how different pharmaceuticals block different pathways. So this is another reason why I may say I'm not going to take a patient. So a person's on multiple medications, it's like, this is going to be a really difficult case. So you're blocking so many pathways with those medications. You're on benzodiazepines, it's going to be a very difficult case. So the least amount of medications you can be on, the better off you're going to be.
Would her book be helpful? She got that sick PDF put together.
Yeah, I think she's done a wonderful job.
What was the question?
Would her book, Dr. Susie Cohen's book, be helpful for a practitioner especially? I think it's really important. So these are all different genes in this pathway. I'm not going to go through them.